LCMC Health is made up of 8 hospitals that serve the greater New Orleans area. We are a part of the culture of our city, a part of the joy, the happiness. We're another element of the gumbo of what New Orleans is all about. And we also are very aware of the neighborhoods that we're in, the zip codes that we're serving, what are some of the challenges that exist in those communities. So out of all the programs that we offer, whether it's innovation, focusing on access, focusing on the social determinants of health, we have opportunity to cover the whole gamut of healthcare, health needs, and health disparities.
Touro has been delivering babies for over 100 years. We are one of 5 birthing hospitals in the LCMC system, and I don't think there's anything that Touro can't handle in terms of helping a family give birth and providing them what they need. So I call it a birthing destination because we have a lot to offer.
I came here to deliver my 3rd baby, and Miss Mila being born here has been my best birthing experience. My OB navigator contacted me at about 6 months pregnant just to check in for my well-being, check in my mental health. That was my first encounter being introduced to the programs that Touro offered.
We are assessing all of our patients that are admitted to the hospital for social determinants of health. We have 8 or 9 questions, including transportation issues, food insecurities, childcare issues. And basically, as we see the need, we try to build upon that and have resources for the social determinants of health that we're seeing most common. We have Family Connects, which is a comprehensive program where the nurses go out to visit them in their homes following delivery. That aids our patients that have trouble with transportation. We go to them.
Family Connects is universal. Every other program I've worked for has been limits to who can have the program. But this program, I am excited that I can walk in every mom's room, regardless of income, race, education. In that early postpartum period when most critical things happen, we are there ahead of those things to make sure that the family is taken care of.
We also have our nursing nest. It's a breastfeeding van that we take to all of the community events. So no matter where you are, you can still enjoy the festival, and it provides a safe, clean space for moms to take a break from whatever they're doing and come in and nurse their babies.
Those type of programs, I didn't know until I came to Touro. And I think that's awesome because every hospital don't provide that.
Our state has a designation for maternal and child health called Birth Ready.
A hospital can be Birth Ready or Birth Ready Plus. Touro is Birth Ready Plus. And what that means is that we provide safe, dignified births to all women of childbearing age.
It really demonstrates our commitment to making sure that we're having the best possible health outcomes for both our moms and our babies. We're looking at the next generation of New Orleanians, and we want to make sure that they have a good start.
We believe that healthcare not only happens inside the walls of the hospital, but should also extend beyond into our community. What we want to do is be able to reach students in schools, reach families in their homes, to support kids on the ground where they are every day with a more proactive, preventative approach before they ever reach the hospital.
ThriveKids is an innovative program that comes out of Manning Family Children's Hospital. We are so excited about this program. It brings comprehensive care nurses, mental behavioral health programming into the schools across the greater New Orleans area.
With so many of the stressors that students in our city face on a daily basis, there's a primary focus on behavioral health, but then we also have a care coordination team at the hospital who are focused on removing any barrier in access to care, especially if there's something complex going on. Our team helps to manage that. And I just think of all the stories of the kids who we've impacted.
My name is Glenyelle Paul Mundy, and this is my daughter, July Mundy.
We met July through our early learning program within ThriveKids. Essentially, the Early Learning Center was just really struggling with how to accommodate what July needed. You know, July has really complex medical needs and behavioral needs. She had a NICU stay and needed feeding support. She also has seizure disorder, autism, other developmental delays. She's also one of the sweetest babies you'll ever meet.
I had just got to the point where I gave up. I was like, she's not going to school. It's just too much. It's overwhelming. It's stressing me out. I just can't work. And this was at a crucial time when I needed to go back to work. Like our life our livelihood depended upon it.
And what we were able to do is be that bridge between healthcare and education to ensure that July could stay in school. And so our team was able to come up with a comprehensive plan to train the team there around how to support July in her needs.
It was life-changing. ThriveKids literally changed our lives, and I don't mean it in like the little cliche way. July was not only in a school program, but had the tools that she needed, the meds that she needed. At school, she was receiving therapy twice a week on top of receiving outpatient therapy. And what I'm most grateful is the progress that July has made. I felt like no one was going to be able to accommodate her. And that wasn't true. And I'm forever grateful for that. To ThriveKids in your program at LCMC.
The trauma recovery program based in our hospital, University Medical Center, is another innovative program that LCMC Health offers.
The Seeds of NOLA Trauma Recovery Center is the first trauma recovery center in the state of Louisiana. In New Orleans, there's a lot of cycles of trauma and of violence that keep getting passed on from generation to generation. So for us, it's important to help people heal so that we can break those cycles. One of the core elements of the Trauma Recovery Center model is assertive outreach. So every single trauma patient that comes in, we go to their bedside and screen them for trauma-related distress. And we can even make them an appointment at that time so that when they discharge, they already have an appointment in the center.
The Trauma Recovery Center here was exactly what I needed at the time. I needed a different level of care, and that is what I found here.
Christian came to me not long after being discharged from the hospital and quickly learned that his mother-in-law was carjacked in his driveway and unfortunately lost her life.
I had fractured my skull, I had a brain bleed, and the mental stuff came shortly after. I was living with a lot of guilt, shame, anxiety, depression before I came here, and she kind of taught me what to do with all those feelings. It was a lot of hard work. It was almost 2 years of therapy. So I left here, whole, experiencing freedom really for the first time since the carjacking.
The system having a trauma recovery center shows that they care about what happens after the physical wounds are healed. For me personally, reaching people who have not had access to these services is really a powerful thing that I'm super proud of.
Here at LCMC Health, I think what makes us different is that we're really connected to our city. We're present and we have become very trusted healthcare partners in our community. And certainly I think that's important for other health systems to really plug into, making sure that each of your hospitals really all reflect the same thing, which is your mission, your vision, and the reason that you exist, to care for your patients in your community.